In a time when our state seeks common ground of agreement, versus planting the flag of R or D on one turf, do we actually need to look any farther than gun violence, depression and anxiety, income inequality, the opioid crisis or racial entitlement? Solutions are needed for our entire state now, and the timing couldn't be better to listen to the dire need for more mental health professionals in Michigan. Although social work is one of the fastest growing professions because of the rise in such issues, with more than 680,000 professional social workers in our nation, according to the Bureau of Labor Statistics, there is a severe shortage of professional social workers in the U.S. to manage the growing caseloads in our communities.
In fact, last year, the Michigan Department of Community Health reported that Metro Detroit has more than 300 designated health professional shortage areas with insufficient mental health professionals to meet the needs of the population.
I am a second-generation social worker. I began my career more than 40 years ago at Hawthorne Center, Children's Psychiatric Hospital, and have been dedicated to helping children ever since. My husband started Wolverine Human Services in 1987 to provide residential services to male adolescents in the juvenile justice system. We've expanded, adding services to different populations over the years to become the largest child welfare agency in Michigan with 6 residential facilities and 3 foster care offices, serving close to 500 children daily.
I commend the bipartisan work of the House CARES Task Force and urge all legislators to implement policy changes and legislation to improve the level of mental health care in Michigan. We are increasingly beyond wanting more professionals to tackle these issues for us. We are now in desperate need. We need legislation to combat the growing shortage of mental health care professionals by expanding Michigan's talent pool. We need more funding. We need to reallocate resources. We need to incentivize mental health professionals to work in Michigan. We need to increase relevant residencies.
We need to recognize that the cultural issues before us require more mental health professionals to help than we simply have now. The problems they solve tomorrow will ease a burden that impacts homes, towns, cities and ultimately, an entire nation. Our social ills don't have one owner. We must recognize that only the addition of more trained mental health professionals can better address those issues that impact us all.